Now, US President Joe Biden and British Prime Minister Boris Johnson have met for the first time on the eve of the G7 summit. They discussed cooperation on climate change, global security and the coronavirus pandemic, including how to safely resume travel between Britain and the US. After their conversation, President Biden also detailed his country's plans to share more vaccines.
And today, we're taking a major step that will supercharge the global fight against this pandemic. In my direction, the United States will purchase an additional 500 million doses from Pfizer vaccine, that will donate nearly 100 low and lower middle income countries. They will be the beneficiaries.
Well, let's have a look at that with Professor Jaap Boom, who's regional representative for Epicenter Africa, a part of Doctors Without Borders. Welcome to DW, Professor. Let's start with that announcement from President Biden. It sounds like good news.
Yes, thank you for inviting me. Indeed, it sounds like good news, but we have a mixed feeling between the good news of having a donation 6 months after the Western country has started the vaccination, but also it's like keep on giving us fish while we actually need to learn how to fish ourselves. So we have that mixed feeling.
OK, so the fish being the vaccine and learning to fish, what is this? This is building vaccination centres or building vaccine manufacturing centres in Africa?
Yeah, definitely. The first part is strengthening the research that can help to find the vaccine that works in Africa. You've seen what happened in South Africa with the vaccine that was not working because of the variant. And the second part is actually building or supporting or strengthening the already existing manufacturer that we have in the continent. That's how we'll be able to produce our own vaccine for COVID, but for all the other diseases that are affecting our continent.
OK. Stay with us, please, Professor. We're going to look at the situation around the world. We've got a map here that shows the average number of new confirmed cases per million people every day over the past week. And if you take a look, you'll see that the highest caseloads right now are in Latin America, with other hotspots in Mongolia and parts of Europe and southern Africa. Now, of course, this data is based on confirmed cases. Limited testing and reporting in some countries means that actual caseloads are likely to be much higher. There are also huge discrepancies when it comes to the rollout of COVID-19 vaccinations. Now, on this map, you'll see that the darker the colour, the greater the share of the population that has received at least one vaccine dose. So we have countries like Canada, Israel, Chile and the UK are all leading the way, but across most of Africa, less than 1% of the population has been vaccinated. Many developing countries, especially on the African continent, are still waiting for vaccines promised by the COVAX international donation programme. Meanwhile, China gave 200,000 doses to Chad this month, the first vaccines to reach the country, where officials are trying to fight the pandemic with limited testing and treatment capacity. DW's West Africa correspondent Fred Muvunyi reports from the Chadian capital, N'Djamena.
At last, Chad has a weapon against the pandemic. Sinopharm vaccines for at least 100,000 people. Not much for a population of 16 million, but it's something. This is the country's main testing facility in the Honorary Proper Hospital. They have been fighting the coronavirus almost blind. The COVID-19 situation was scary at the beginning. We tested patients who came to hospital and some of them tested positive. Some of the health workers and other patients died of COVID-19. Official figures show less than 5,000 infections and fewer than 200 COVID-19 deaths. The real numbers are almost certainly higher, as testing and healthcare infrastructure is so poor. That creek infrastructure and political instability left Chad near the bottom of the list for international vaccine help. Until last week, when the COVID-19 task force got supplies from China.
Quand on a reçu le vaccin Sinopharm,
When we received Sinopharm vaccines, it was really a great joy for us.
Un plaisir pour nous d'avoir reçu ce vaccin-là.
Health workers, pilgrims going to Mecca, and patients with pre-existing conditions are a priority. Officials know the Chinese donation can only be the first step. These fridges are ready for vaccines yet to come.
Avec le mécanisme
Under the COVAX program, we will get doses that will vaccinate at least 20% of the population of Chad.
20% de la population.
Only a few come for vaccines. Many are skeptical of its origins. If we had the means to get other vaccines, we could. But if we don't have the means, and this can protect us, just because it's a Chinese vaccine doesn't mean it's bad. Sinopharm vaccine doesn't yet have European or US approval, but the World Health Organization says it offers up to 79% protection. In Chad, people are used to taking what they can get.
That's Fred Muvunyi, reported from N'Djamena. Now back to Professor Yap Boom. Professor, we've just heard about the problem of vaccine scepticism. Is this something that you've encountered?
Yeah, definitely. That's a very important problem that we see in many countries. You mentioned Chad is the same thing in Cameroon. In DRC also, they've given back part of the dose of vaccine that they were having. In Malawi, vaccine have expired. I think people are not willing to take the vaccine because most of them, they don't feel like they are having a higher risk of getting the COVID. And even if they get the COVID, they don't feel that they have a risk of dying from it, as compared to taking a vaccine that they might not trust because of all the information they get on the social media.
Right, so, and getting your hands on vaccine is the important thing there. So China sending in those Sinopharm vaccines outside of the COVAX system. Is the COVAX system working?
Well, it depends on the country. You have a country like Kenya. At some point, they received 1 million doses from the COVAX initiative. They used 900,000 for the first dose of the population. And at some point, there were no more doses for people to have the second dose because of what was happening in India, as India is producing the AstraZeneca for African countries. So it's really a challenge for some countries that are most at risk and at need, Kenya, South Africa, and so on. While on the other hand, you have countries that don't want to use even those vaccines that they are receiving. So it's quite complex, and the situation across the continent is quite heterogeneous.
All right. We thank you for joining us and explaining that to us, Professor. Professor Yap Boom II from Epicenter Africa.
Pleasure.